Hi guys, it's Sarah. I'm going to teach you how to document in a postpartum hemorrhage. So first, for medication, you'll scan your patient's bracelet. I don't have a bracelet to scan, so I'm going to hit next, but you would scan the patient's bracelet like you would to give any medication. And then when they're ordering medications for the postpartum hemorrhage that aren't on the active list, you'll hit create, order, and document. And then you scan whatever the medication is. Here we'll select the override reason that we clarified with the provider and hit continue. And then you'll put whatever doctor gave you the order. So let's say, for example, Dr. Florence gave us the order for Methergin. We'll click on Dr. Florence, okay. And then it's going as verbal with readback, which is okay because this is considered an emergency. For route, you'll select IM, the site, let's say left thigh, and then hit sign. And then your medication was signed and scanned. So if you go to your MARS summary, you can see that we gave the Methergin at 13:32. So that way you are entering the order and scanning the medication at the same time. If the doctor wants you to add an order for stat H&H or any kind of labs, you just do add, search. We'll search for H&H. Search for hemoglobin. There we go, hemoglobin and hematocrit, stat, and then the same thing. You enter the name of the doctor that gave you the order. So we'll do Dr. Florence again. And it's verbal with readback because it's an emergency. Hit done. And then blood stat collected, no. And nurse collect, no. And then hit sign. And then there you have your order for your H&H. In iView, under the OB systems assessment, you will document all the vital signs that you take during the postpartum hemorrhage. Under postpartum, you'll do your fundal assessment. You can also document the QBL at the end of the postpartum hemorrhage. And then once after she's bled, you need to go back in and fill out the postpartum risk assessment again because it changed considering she had active bleeding. When you notify the physician, you can do an ad hoc for clinician contact. So we'll put again Dr. Florence, the date and time, and then you can just put here, so this would be when she gets to the bedside, in person, acknowledged information, reporting results, and then you can document a little note here, MD at bedside, patient actively bleeding. Anything else that you told the doctor, you can include in there. You can give an SBAR report and then sign it. And then another thing to do would be a note when the postpartum hemorrhage started. Do a progress note. We'll say the patient started bleeding at 13:32. You can title it PPH. You can just put a brief summary of what happened. Patient noted to be actively bleeding. PPH called. Charge nurse and primary RN at bedside. Dr. Florence arrived to room. See iView for detail. Because in your iView, you'll document your vital signs, the bleeding, and everything else that's relevant. And then sign that. And then your note would come up here. And that's it.